The difference between a nursing home and other care homes is the fact that in a nursing home, residents require 24 hours care and medical attention from nurses. So that means that in other care homes, apart from nursing home, the need for a nurse is not required. So in a nursing home, the nurses are always there 24/7 to help with residents, because most of the residents in the nursing home require medical attention. Medical attention because they have critical health condition. Some of them got cancer. Some of them got, complicated, health situations. So as a result, they would need the help of a nurse in the building. So for a nursing home, the nurses are there, carers are there, senior carers are there. But my attention today in this video is with regards to nurses. I have been a victim of first-hand bullying and a situation where nurses force carers to give medication. How do I mean? In a nursing home, the carers are not permitted to administer medication, because that is why the nurses are there. So, but I've seen a situation, even when I was a carer, where when I work in a nursing home, most of the residents need help with feeding, like you assist them to feed, because they don't have the capacity to take their, eat their meal. So the carers most of the time go into the rooms of the residents, adjust the bed, make them sit down in a seated position. So while they are seated comfortably, the carers support the resident with their food. Along the way, the nurses, are going around with their trolleys and they are giving medication, because they have a particular time slot to give, for instance, 30 residents. They are, I don't know, it's either they don't manage their time properly, they end up giving carers medication to administer to residents. This is a bad practice, because the carers have not been trained to give those kind of medication in nursing homes. Carers in nursing homes, you have not been trained to administer medication. That is why the nurses are there to do their job. You have not been paid. It's not part of your job role as a carer to give medication in a nursing home. So first, say for instance, a nurse could walk up to one of the rooms where you are supporting residents to take their meals, and they tell you, please, they leave the medication with you. By law, you are not allowed, you are not permitted to administer the meds, because you don't know what the meds is about. You've not been trained about the meds. You might think you're doing a favor to the nurse, but according to the UK law, you are not permitted to administer medication in a nursing home. That is the job of a nurse. So the next time you see a nurse walking around with their trolleys and they are giving you medication, oh, I'm running late, can you please kindly, politely reject it. Because if anything happens while you're giving the medication, it will be used against you in the court of law. Because one of the questions that you'll be asked is, have you been trained to give meds? You have not been trained to give that particular medication. Your job role does not entail giving medication in a nursing home. It is the role of the nurses to administer medication. So carers, I'm calling your attention to this, through this video. Do not be under any form of pressure from nurses to administer meds. They should, that is their job, not yours. They should plan their time well to be able to give medication to all the residents. So I want to use this opportunity. If you have experienced any nurse in the nursing home forcing you, bullying you into giving medication or administering medication, can you please comment, below in the comment section? Because you are not permitted under the law. The nurse know, they are aware. The next time they ask you to administer medication, you can confidently tell them, are you aware that I'm not being trained? And they will know for sure that you know what you're doing. Until my next video.